Alzheimer's disease is a progressive, irreversible neurodegenerative disease that affects the brain, targeting memory, thinking skills, recognition, and the ability to form gestures. Although not a normal part of aging, patients diagnosed with Alzheimer's are typically 65 years of age or older. Those diagnosed at a younger age are considered to have a rare genetic form of the disease. Alzheimer's is a continuous deterioration of brain neurons that eventually shrinks the actual size of the brain. Let's take a look at how the brain is affected. This example displays 4 different stages of the disease and how it affects the different parts of the brain. The first stage is mild cognitive impairment that starts in the medial temporal lobe. Symptoms associated with the beginning stage is short-term memory loss. The second stage is mild Alzheimer's that affects the lateral temporal and parietal lobes. Symptoms progress and result in reading problems, poor object recognition, and poor direction sense. The next stage is moderate Alzheimer's. It progresses to the frontal lobe. Symptoms include poor judgment, impulsivity, and a short attention span. The final stage is severe Alzheimer's, where all lobes of the brain are now affected. Symptoms now include visual problems. Now let's take a look at the changes in the brain that lead to Alzheimer's. The brain is made up of neurons that form to create a communication network. Alzheimer's directly targets these neurons. Alzheimer's starts by 2 lesions in the brain, senile plaques that are composed of beta-amyloid proteins and neurofibrillary tangles that are composed of tau proteins 15 years before the symptoms first occur. First, neuron-toxic amyloid beta oligomers form and disturb synaptic communication. Then, senile plaques form by unregulated amyloid beta protein and are found in large quantities. They assemble and form senile plaques. Finally, neurofibrillary tangles formed by the tau protein becoming defective on the neuron's microtubule skeleton and detach, causing the skeleton of the neuron to disassemble, resulting in the neuron to degenerate and lose connection between other neurons, which ultimately leads to the death of the neuron. The spread of neurofibrillary tangles cause dystrophy to the brain. As progression of lesions occur, the symptoms become more severe, starting with memory problems, language problems, recognition problems, and the inability to form gestures. Now that we've discussed what Alzheimer's is, let's take a look at how the patients are diagnosed with the disease. Diagnosis is solely based off an evaluation of the patient by reviewing their signs and symptoms. Currently, specific testing to diagnose people with Alzheimer's is unavailable until after their passing, as a brain biopsy must be completed to confirm a diagnosis. However, a detailed physical and neurological examination may be performed, along with diagnostic imaging such as CT or MRI, to rule out other diseases. As for early onset Alzheimer's, cerebrospinal fluid collection may be performed to test for biomarkers of the disease for potential diagnosis of early or rapid onset Alzheimer's. After a patient is diagnosed with Alzheimer's, pharmacologic and non-pharmacologic interventions may be recommended. Although there is no cure for the disease, treatments are available to mask the signs and symptoms. There are currently 5 FDA-approved medications to help treat different stages of the disease. The first type of drug, cholinesterase inhibitors, include 3 out of the 5 medications available. It works by inhibiting the enzyme acetylcholinesterase, which in return improves cholinergic function by making more acetylcholine available. It can improve cognitive function as well as reduce other symptoms of the disease. The second type of drug is a N-methyl D-aspartate receptor agonist, also known as NMDA. This accounts for only 1 of the FDA-approved drugs. NMDA works by controlling the movement of glutamate in the brain that allows calcium to enter the cells, preventing cells from being damaged too quickly, thus slowing down the disease process. The last type of FDA-approved medication is a combination of both types of medications. Non-pharmacologic interventions are recommended simultaneously with pharmacologic treatments. Non-pharmacologic treatments include aromatherapy, massage, music and white noise therapy, bright light therapy, and psychological therapy. Each type of therapy is tailored to patients' specific needs and have been proven to improve the symptoms and quality of life for patients with Alzheimer's. Although there are many therapeutic options for patients with Alzheimer's, the symptoms will worsen over time. Alzheimer's is the sixth leading cause of death in the United States due to the complexities that are associated with the disease. Not only can a diagnosis of Alzheimer's be devastating to a patient, but to their family as well, as it is known as the long goodbye.